So my name is Rupert Handgretinger. So I'm the head of pediatric hematology oncology at the Children's University Hospital in Tübingen, Germany.
You're a state-registered oncologist in Germany, pediatric oncology, and you work within the conventional health service of...
Yes, in a setting of a pediatric university hospital.
Okay, so you are a professor?
Yes.
Because it's a university hospital you teach?
Oh yes,
yeah.
It's a teaching hospital.
And you've flown over from Germany last night to talk at this Institute's conference today?
Yes.
Which is quite a commitment, thank you.
Yes. So my talk is how our approach from our view on cancer therapy in children especially, but also adults, how to harness the immune system, how can we harness the immune system to treat cancer and hopefully to cure it at some stage. Before we harness the immune system, we have to understand it. So our research is focused on better understanding how the immune system works and then how we could use it against cancer in the body.
So in a sense, a completely radical perspective, because the majority of conventional treatments for cancer at the moment tend to harm and destroy the immune system. So this is working from the other way around.
We employ both. Approaches. I mean, we have a number of patients whom we can, at least in pediatric, in children whom we can cure with our conventional approaches. There is no doubt, and we wouldn't change any procedure. For example, over the last 40, 50 years, the rate of cure in children's leukemia has gone from 0 to 80% by conventional approaches. But it still leaves us a number of patients and with other tumors also, especially sarcomas in children, soft tissue sarcomas mainly, where despite all our conventional approaches, and that includes radiation, chemotherapy, of course surgery, where we do not have a success in curing these patients. So, and we lose too many patients. So this is why we are now looking for other ways to approach these patients and evaluate other therapeutic strategies. And one of these strategies is the immune system, to harness the immune system.
Yeah, could you outline the sort of principles and practices of your immunotherapy?
One of our focus is to use especially the innate immune system, which consists of so-called natural killer cells, which have gained a lot of attention over the last years, because we are trying, or we are in the process to understanding much better how they work, and this is what I will also a little bit cover, new findings, how natural killer cells work. And we think that natural killer cells are a surveillance system in the body which screen the body daily, or as we speak, in every second for potentially malignant cells and eliminates them. And I think we have done a good deal how to understand how they do this. Of course, we understand not everything, but we're making progress in getting more on the biology of these natural killer cells. And of course, once we understand them better, we can harness them better and use them better for therapeutic approaches. And this is what we are doing in a number of patients now, also in clinical studies, to use natural killer cells to try at least to cure children and also adults with cancer.
That's fantastic news that these killer cells exist at all. You talk of innate killer cells, so these are things that the body produces and supports in functioning all by itself.
Yes.
That does the policing and militarization.
They do the policing, but we, of course, the thing is, what probably in patients with cancer, the system fails for some reason. So, and this is where we have to come in and maybe to reactivate or to repair the failure of the system out and bring them back to a better status. I mean, we don't know why patients get cancer. whether it's from the beginning a failing immune system or the surveillance system is not working appropriately. That's all unknown. There are data out there from others that persons who have a poor NK cell system might have a higher incidence of developing cancer. So there is a hint that the surveillance system is important, and I think nature would not have developed such a surveillance system just for nothing. So I think that must have a good reason, and this might be one of the reasons to have this surveillance system in place for at least cells which are different from normal. That must not always be cancer cells. That's also virus-infected cells, which does not look like a normal cell in the body, which is attacked by natural killer cells. So we do a lot of research there and also do clinical studies to activate these natural killer cells. We use some substances which might not come out of the mainstream medicine. There are drugs which activate NK cells, which are known to do that, but there are also other approaches to activate NK cells. And this is a little bit my relationship with this convention, that we use also substances which are maybe not used in classical medicine, but where we have shown in our research that they activate NK cells. And it's exactly what we want to do. Wherever the drugs or the substances come from, as long as they activate and we can measure it, it's good enough for us.
Well, yes. So where do they come from? These are natural substances. Is that?
We have one study ongoing with natural substances, yes, which are extracts from rice and fermented rice. So and there are substances in it, and that might also be bacterial substances or residuals of bacterial walls, which activates the innate immune system. I mean, that's something how our body probably works anyhow. And we try now to identify, of course, the mechanisms, how these ingredients activate the NK cells, try to understand what are the mechanisms involved, how and maybe then find ways to even improve this activation. Once we know more on the details, how something works, maybe we can harness it better. But this is still an open question. So we do research there and in the laboratory, but also in small clinical studies.
Do you support the idea of supplementing with vitamin D and vitamin C and things like perhaps iodine or alkalizing with bicarbonate? Do you look at those magnesium deficiency and its effect on the immune system?
I think if you have a normal lifestyle, you do some sports, you do some exercises, I do not think you have to supplement a lot, because the body is built to do this itself. But there might be some approaches where, for example, these substances might have an anti-tumor effect. And as long as we could measure them in vitro or in other studies or in clinical studies, then I would be in favor to do that. And this is what we are doing. I mean, if a patient has an abnormal lab value, let's say he has a very low potassium or sodium, we replace it. If he has a low magnesium value and he is not feeling well, maybe we would also supplement. But I would not, we don't know whether magnesium alone, for example, this supplement has now automatically anti-cancer effects. This is something we have really to look very closely at. If something is abnormal in the lab, in the patients we treat, we would of course adjust it to normal levels, but I would not say now everybody has to take, every healthy person has to have magnesium supplemented in his diet. I think this is not, for example, necessary. We have to discern whether in the healthy and unhealthy status.
Yeah, if you look at lots of green vegetables, then you're going to get enough magnesium.
If this is a well-chosen and balanced diet, I think it's fine from our perspective.
But the word "if" comes in there, which is obviously significant really for a lot of people in the Western world who perhaps don't eat a lot of organic green vegetables and perhaps don't get enough magnesium, and so I think you can find a spectrum of deficiencies that start to contribute to that.
And we also try, of course, I mean, we take a rather also radical approach in our treatment, at least in children, which is successful for children who have otherwise no chance for cure with conventional therapy. So we also do allogeneic bone marrow transplantation. That means we eliminate a patient's immune system completely and replace it with a new one. And this is also something we do more and more research on it because it seems that that this replacing of a new immune system by a bone marrow transplantation, or we call it stem cell transplantation, gives the patient a better surveillance system back.
Stem cells sound like absolutely miraculous things. Could you tell us a little bit about what exactly stem cells are?
No, we are speaking only of hematopoietic stem cells, so stem cells which produce the blood and the immune system. As you know, all our blood and the immune system is generated by the bone marrow, and the bone marrow is the place where the stem cells are. And these stem cells are supplying us for a lifelong with our blood. And every second you sit here, your bone marrow produces, for example, 2 million red blood cells in 1 second. So this is a quite active organ, stem cells. And these stem cells have not only to produce the immune system and the blood platelets, the white blood cells, the red blood cells, the T lymphocytes, the natural killer cells we all need to have. They also have to make sure that they do this for 80 years or longer, as long as you live. So they have quite a big task there. So it's a very interesting organ, the bone marrow. And we are also doing a lot of research with this kind of bone marrow stem cells. So I'm not speaking of embryonal stem cells or any other stem cells. We only see what happens when we do not have a bone marrow. A functioning bone marrow is either in children which have an inborn error and a bone marrow failure, and without a transplant they would die within short time. Or sometimes patients feel it after chemotherapy, where we transiently suppress the bone marrow by the therapy we give against cancer. And of course, this is the yin and yang of therapy. On the one hand, you have to somehow suppress the tumor growth. On the other hand, you have to damage during this the immune system. So this is a problem. But it's also a problem that you might have a fast-growing tumor, and then the immune system, if you only put all your eggs in one basket and you only treat a fast-growing tumor with the immune system, it might be overwhelmed. So that's the problem. So I think from our perspective, you need something to treat a fast-growing tumor, that you can stop the growth and maybe then employ the immune system. Which is a different problem in adults and children. Children have maybe faster growing tumors than adults. In adults, it takes maybe several years until you get your prostate cancer or your colon cancer. In children, this is in between weeks or a few months that they have a big growing tumor. So there are differences also. So maybe adults, you have more time to manipulate the immune system than children. But even if we supply all our intensive chemotherapy in certain tumors in children, the success rate is still not very high. So that's why we are now going more and more into to the avenues of employing the innate, the body-own immune system to fight these residual cancer cells. which are always around probably. Otherwise, we would not have all these problems with relapse of cancer. So most patients do not die from the cancer, primary cancer, but from relapses. That's the problem.
The very concept that you're discussing here, I think is something very new, really, to the conventional system, who seem to, predominantly focus on using things to kill the cancer cells. And so now to talk of this sort of yin and yang and the balance between these two processes, and to consider a patient's treatment in terms of, do you strengthen the immune system, do you use chemotherapy to take down the cancer load and then come in? I think for me that completely resonates with my understanding of the way we need to evolve in terms of our treatment of patients.
I do not think that it's that new, because there is a lot of research in academic medicine on the immune system. So there are a lot of groups looking how to harness the immune system better. Of course, before we harness it, we have to understand it. This is, I think, we cannot just say, we activate the immune system a little bit by this, and we give a little bit of this, and then your immune system is most likely activated. I don't think this is working like this.
Yeah.
So you have to understand it, then you have to show that you can do it, and then you have to, maybe it's first in the lab or in other models, and then you have to do it in patients. So this is still what I think. If we have new approaches to treating cancer, especially with the immune system, then we have to show it. We just cannot claim it. That's, I think, something we have to make sure that.
Absolutely, and it's wonderful to be able to be working specifically towards that goal. But as a practitioner, I regularly see patients with, for example, breast cancer who've come to me and they've had surgery, radiotherapy, chemotherapy, hormone therapy, and then basically they're put onto the streets. Basically,
yes.
They're not told any dietary advice really significantly or anything, and so the whole concept of strengthening somebody's immune system who has already had some is, certainly in my experience in terms of local general practitioners and local oncologists, not something that they give hardly any time or regard to in clinical practice.
Maybe that could improve over time, that once the patient have gone through all the conventional therapies, and most patients might have it, especially in adult cancer, to find ways maybe to try to further treat them. And there maybe the immune therapies can set in. We also trying to find new ways to vaccinate against tumor cells, so to induce a immunological memory, like we vaccinate children against measles. That would be, of course, the dream of cancer immunology, that you can have somebody's immune system maybe recognize the cancer whenever the cancer comes back, and the immune system right away jumps on it and eliminates it. But that's, I think, still a long way to go. But this is, of course, the goal. And there, I think we need new approaches, new thinking, how to do this.
I'm a registered medical practitioner with the General Medical Council in the UK, so I'm a doctor.
So what is what?
I use acupuncture and Chinese herbs and dietary advice, and mainly I would suggest people come off dairy products and sugar and refined.
So sugar.
Yeah, sugar, dairy products, refined carbohydrates, white flour, white sugar, all of those sorts of things. Eat a lot more organic green vegetables. Do juicing. Organic brown rice. Quality fish and meat, and
something which we should do anyhow as healthy persons. Right?
Yeah, absolutely. Yeah, so should but don't often.
It's not
you follow the average person into a supermarket and see what they put in their trolley and they take home. It's frightening. And then we wonder why their immune system breaks down. But I advocate using Epsom salt baths to support magnesium. Like Damien Downing suggesting that they take vitamin D supplements. I often advocate iodine supplementation to the same sort of rate that the Japanese take on an average daily basis. You make sure the body's pH is maintained within the normal range. You give vitamin C, build levels of iron and B12 up in people. use Chinese herbs and.
But with a good normal diet or whatever you should normally eat, you would have all this already.
Well,
if you have enough vegetables.
Yeah.
And all
although
this.
we don't get enough vitamin D living, in the northern hemisphere already, and there's certainly a lot of research to suggest that anybody living north of Paris is likely to be vitamin D deficiency, especially when you spend all day sitting inside looking at a computer.
That might be different, yes.
Yeah. And I think it's certainly good to take lysosomal vitamin C. The body seems to respond quite well to that. That seems to be a beneficial support really for people's.
I mean, people have getting the Nobel Prize for that.
Yes.
So it's not that out of the realm. Huh?
Yeah. Huh? So I tend to sort of cherry pick.
Dr. Pauling has gotten the Nobel Prize
for vitamin C. Yeah.
Isn't he the one who?
I don't know.
Introduced the high-dose vitamin C in the treatment of.
I think.
Yeah, Linus Pauling.
Fantastic! I didn't know that.
He's a Nobel Prize laureate.
Yeah. So I tend to use things like that, the simple common things that, people are commonly deficient in, and it seems to be quite beneficial with good exercise and Chinese herbs for their particular pattern and acupuncture and use a sort of broad spectrum approach that's quite beneficial.
Yeah. So, for example, we in our hospital or in my floor we use also acupuncture, but for to prevent emesis, chemotherapy-induced emesis in children, and it works quite good to control vomiting, chemotherapy-induced vomiting. So acupuncture is is a good method to at least relieve it to some extent. You cannot completely prevent this. Nothing is 100% in medicine.
Yeah, it's quite. Acupuncture gets very good results for musculoskeletal conditions and helps the digestion and helps people relax very deeply and sort of clear stress from their system and in combination with other things it's quite beneficial. They use it a lot in Penny Bron cancer care. The Bristol Cancer Help Centre. They use acupuncture a lot to support people.
Also for pain or
for pain. Yeah, for pain, but also for stress, really.
So it's also stress relieving.
Yeah, because the whole body, the sort of pain and the relaxation, and it all sort of comes together.
That goes together probably.
Yeah. So, Professor, what do you see the way forward in terms of the treatment of cancer and the cultivation of health and immunity of those with cancer? As these sorts of principles and methods expand, how do you see that evolving then?
I think it will be a very individualized approach because research shows that every cancer is different. So, and maybe sometimes even cancer cells in the same body are different from each other. So this is, I think, the big problem. So cancer of person A is different than from the same cancer from the patient B. So there are different mutations, different changes in the DNA of these cancers. And I think new approaches have to take into account these individualized changes in a person's cancer. And this is and I will show this a little bit in my talk also, what we are trying to address, that the future will be more on individualized therapy in terms of the immune system. So I think we have to prepare maybe a kind of vaccine for every patient's cancer. So we cannot take vaccine from patient A for patient B. I think that's maybe already the tumors are too heterogeneous. I think this is at least in my personal view where we are trying to do more research, stimulating the innate immune system. This can be done in every patient, but this is, I think, something which we should do to support anyhow the body. And this is, of course, a good diet, enough sleep, not so much stress. This is the normal what you recommend to anybody anyhow, to have a more healthy lifestyle, to do sufficient sports, exercise, also good for your heart, and of course for a lot of things. Adjust your weight a little bit or look at your weight a little bit, that it's not too overweight. I think all these things is something which support, but they will not cure alone cancer. This is probably something I would say, and then we need more to specifically attack cancer. And so our approach now is to try to individualize this kind of cancer vaccination with the production of patient-specific vaccines.
That sounds very exciting.
For every tumor.
Almost, in a sense, like homeopathy, where you take it and then you give back a small amount. You actually get what you actually use the person's cancer in order to then create the vaccine to that cancer, so that it's person specific. Is that?
We try to extract certain immunogenic changes, which the body, of course, how the immune system works, that it recognizes body's own normal cells and foreign cells.
Yeah.
And if in the state of maybe cancer, the immune system has somehow not learned to attack the cancer cells because it does not recognize. Or somehow the cancer has developed mechanisms to make the attack system, the patient's immune system, tolerized. So it does not attack, it's blind for the cancer. And cancer is a very smart thing. So they can, whenever you do something, they will counteract. That's the problem with chemotherapy. You do chemotherapy, you do this they will respond. You do this for a while, they will become resistant. So they develop mechanisms, and they do the same with the immune system. The immune system might attack it. They develop escape mechanisms to circumvent the attacks of the immune system. This is something which we also see more and more, that and also with the new therapies, nowadays the so-called targeted therapies or small molecule therapies are very active in research, but one can also see already that the cancers develop can rapidly develop mechanisms just to get refractory or to resist to these approaches. So there will not be one single approach, I guess, for that reason. So we need to have more avenues to fight cancer. Of course, the best is a somehow healthy body, as healthy as we can get by normal means, normal lifestyle, as I said. But then I think we need the immune system also. Whether we need others, that the research has to show. I mean, I fear there will not be a magic bullet which cures everything. So it will be different approaches. But I think it's important to bring somehow the cancer back to a state where both can live. So I think that's more and more now, that we will not be able to cure cancer, but we can maybe bring it back to a chronic disease, so that you can live with your cancer to some extent, but it will not disappear. That's a little bit my personal view.
So in a sense,
balance goes back in terms of surveillance, and both systems can live with each other. I think that's probably where we have to go in the future, to bring the body back to that balance. Of course, the goal would be to eliminate every single tumor cell, but I think we will not get. I'm quite pessimistic. But as long as the patient can live with these few cancer cells in the body and they are fine, it's good, it's fine, it's good enough.
Do you think most of us sort of live with cancer cells, throughout our life? Do you think this is a sort of constant flux, in a sense, between little things arising and the immune system dealing with it, and then?
I think that my personal view is that maybe not directly with cancer cells, but with pre-cancer cells, that especially our NK system maybe has been developed by nature to fight these cells which might make a problem in the future. So the system, how it, as the NK cells at least, how they work, that they eliminate just every cell which looks strange. And they do not attack the healthy cells, but they attack everything what looks strange. That might be a pre-cancer cell, and we don't know what a pre-cancer cell is. This is also the problem, because until it comes to a cancer, it seems that the cell has to go through many steps of changes in the DNA, in the genetic information. And it's not only probably one change, one mutation is not enough maybe to make a cancer cells, a real malignant cancer cells, but maybe it has already a little bit the taste of a cancer cells. And I think our immune system is able to recognize such cells which are potential problem makers and can eliminate them. So why then it's not working in the patients with cancer, we don't know. But I think even as we speak in the healthy body, this continuous surveillance and elimination of those cells which look a little bit strange to the immune system, they are eliminated. And then for some reasons, somehow our NK cell system or our immune system gets worse, especially when we get older. And it is clear, and one out of 4 people, older people, will get cancer. That's and probably this is also due to the less effective immune system, which gets less maybe in terms of the surveillance system when we grow older.
So yeah, talk of an integrative approach in the future. It's going to be a sort of broad spectrum way of approaching it that's individualized. How can people in their day-to-day life support the increased function of their innate killer cells? Is there anything that you can offer people in terms of specific advice?
I mean, what has been shown is, for example, that sport activates the natural killer cell, exercise activates the natural killer cells, that this has been investigated. And I think a somehow normal lifestyle. I personally do not think that you need all these various additional ingredients and whatever. If you have a somehow balanced diet with enough vegetables and not go to McDonald's every day, 3 times a day, this is surely not balanced. So, and if you try to, I think, maybe hold a little bit your weight to some extent, this is a big problem. Obesity in our societies. I don't know here in UK, but I even see it in children in my hospital, that obesity is a increasing problem in children already, where it starts. This is surely not healthy for the organisms. We don't know whether this has to do anything with cancer at the moment, but I think there are data out there that maybe obesity and cancer has some correlation with each other. Whether this is then related to the immune system, to my knowledge, probably has not been investigated.
Or perhaps to people that are obese who eat too much sugar and refined carbohydrates.
That's surely a biased diet also.
Yeah, obviously they've got a much worse diet towards diabetic in nature and hypothyroid and
yes.
That whole sort of tendency.
So that would be also for children, where I'm more probably expert in children, so I would not recommend now any specific diet in terms of supplemental increase. Of course, the vitamin D in early childhood is something we do anyhow. Whether it's necessary later, I think that's also a personal view what a person wants to take or believes in.
Yeah.
I would maybe, of course, there are a lot of, I have also to say, a lot of people out there claiming things which are not really also proven, also in cancer therapy, or that you have to get very expensive therapies because you get promised that you will be cured, and you spend your last money, you sell your house, everything to get cured, and nothing has been proven. So there are a lot of these things out there, which I think should also be somehow restricted to. We need some evidence that something works. I'm not saying we should only now do evidence-based medicine. So there are always individual patients which we have to consider. But I see also when I look in the internet what promises are made that cancer can be cured with this, or you give this, cost here 20,000 euro, or this 10,000 euro. This is unfair to the patients.
Yeah, no, I absolutely agree, and that's inappropriate.
Yes, but these things happens every day. That I think it's only few people, but who misuse such a system, or who misuse a patient's need for or search for cure. So where is your office then?
Down in Devon, Totnes, Devon, sort of about 3 hours south of here. Yeah, it's a very nice part of the country, hilly.
Oh, Devon, that's south of London.
Yeah. Yeah, so Dartmoor basically is a big national park down there.
Oh,
so,
okay.
it's quite a sympathetic town, really. It's lots of.
And you have a lot of cancer patients, or what kind of everything?
You get a full spectrum, really, of people coming. Basically looking for immune support, realizing that their health has been affected by chemotherapy, radiotherapy, surgery and hormone therapy, and perhaps they haven't had a very good diet, or and they just want to start to put their health back together again.
And is your health system supporting this, or?
No, that's what I'm saying. They wouldn't recommend vitamin C. They would, they don't talk about not eating sugar and eating more organic vegetables. They're not given that sort of broad spectrum health support, really. They're just said, you've had your treatment, go and get on with it, really. And
do you give other approaches, or any other dietary supplements, or?
With the dietary approach in terms of keeping off wheat and dairy and sugar and all of that, eating more vegetables, juicing and all the rest of it. We recommend. We have weekly workshops where people can come and talk about all these issues and get emotional support and.
I think this is also something important, the emotional support that people can talk with someone or to somebody. I think this is maybe in the conventional medicine, maybe something is somehow gone under,
And because
the pace is too fast, that tack. I think this is also something I see that.
And also then if we're sort of working with their diet and their exercise and emotional issues and doing our best to help them get stronger and fitter and healthier and take more responsibility for everything in their life, then they're concentrating on something positive, on getting as well as they can,
this is
and
important.
rather than just having a negative diagnosis and just carrying on, sort of wondering if it's going to come back. They're actually constructively employed in building health.
This is the most important. If they have to sit there and waiting until it comes, passively waiting until it comes back, I think this is the worst thing, right?
Absolutely, yeah. So giving people that hope and that support, and
Yes.
you know, dietary regimes and exercise regimes and
exercise, I think, is very important.
But in a sense, I think vitamin C, vitamin D. I do think magnesium is important. I think iodine is important. I think getting the body pH.
Iodine?
Yeah. So, because there's a World Health Organization iodine deficiency report that states.
How do you balance the pH?
With a blend of sodium and potassium bicarbonate, and monitoring the urine and the saliva.
Okay.
And just bring the pH back into the normal range, because most people are too acidic. So just bring the pH back roughly into the 7.5.
So you look in the saliva or?
Saliva and urine, yeah.
What's the normal pH what would be my pH? I never measured the pH in my saliva.
Well, normally 7.325 is determined to be.
I never thought about this, yes.
Okay. And there's a range, but most people are too acidic, because most, toxic effects and stress effects, drive the pH to become too acidic, and then that doesn't. The view is that creates an unhealthy environment for the immune system to function if everything is trying to occur in an acidic environment rather than optimal pH.
Yes.
So we just use the already acknowledged, range of what's considered to be normal physiologically, and just support the pH returning into that, just so the system runs, at.
But when the patients do this, then they have to buy these things themselves, or is your insurance system covering these things?
No, that's the trouble.
They promise you everything, they inject you some cells and they cure everything. They cure Alzheimer's, they cure cancer. Yeah. But you have to give them 20,000 euros. This is the criminal attitude.
Yeah, no, I charge €30 for a consultation, and people come and they buy some vitamin D, buy some vitamin C, they get some advice on diet. It's a continuous, ongoing support that people find very, very helpful, really. And we take videos of people and put them up on the website, and so people can get an understanding of the broad concepts of. Working with themselves to cultivate their health and well-being and immunity, and in a sense, it's fairly simple. It's but it's also a fairly broad spectrum, trying to approach the full spectrum of human needs and physiological needs. Really, I give zinc and selenium, and make sure.
I mean, this is how I came here. Because we do some study with this, which is called MGN3 or Biobran.
Yeah.
I'm not sure whether this is used over here.
Not very often, no.
Because I think it's quite more
expensive, yeah.
To some extent. So this is where we did studies to I show some data also to stimulate the NK cells. So where I have so I was on a conference by chance, and then there was this little exhibition, Biopran stimulates your NK cells. So I went there and I said, I'm working now since more than 25 years with NK cells. So I went there and challenged the guy, you claim it's activating NK cells, have you shown it? And then he told me, you can get some and try. So we did in our lab, and it's quite interesting. That's why I'm looking more into this now.
Fantastic.
And trying to identify the compounds. Of course, this is a mixture of a lot of things. But this is then where research starts in, biochemical research to identify exactly the mechanisms, how does it activate the immune system or the NK cells.
Yeah.
So we do little studies also with this. That's why I think they asked me to come here, this company with the...
Well, it's excellent, that we're finding natural substances that are non-toxic, they don't destroy the immune system.
At least it's very well tolerated.
Yeah.
You can take tons of it.
Yeah. And it's not going to do any harm at all.
No, that's the good thing.
Yeah.
Very interesting. So how many patients do you see then? A day or?
I've got a number of treatment rooms. So so I might see 20 people a day or something.
So there's big need.
Yeah, there's a lot of people.
And a lot of patients then probably are out of the conventional medical system with relapsed tumors or given up or.
Yeah. Yeah, definitely.
And the system here is quite maybe stricter in terms of maybe retreating patients when they relapse, or.
Yeah, you have to be very, very careful here. You mustn't make any. You cannot claim to treat anybody for cancer, or even to offer advice in terms of treatment for cancer. You can only offer advice to say that you will strengthen their health and well-being and immunity.
And what would happen if you claim to give them advice for their cancer?
Well, then you've broken the 1939 Cancer Act, which is a criminal offence, and you can be struck off the register and prohibited from having insurance and fined, and if you carry on doing it, you can be imprisoned.
Oh, really?
Mm. Like when I first started up, I was saying things in not quite the right speak, and yeah, the trading standards and the MP and the mayor, and they cancelled a conference, and they got very excited, so that we had to shut the whole process down and then sort of learn how to say.
So also now in your internet forum, you have to be careful.
All the time have to be careful. But again, it is also appropriate, because I understand, because exactly as you're saying, there's a difference between anecdote and evidence, and and if something hasn't got the full substantiated evidence that it is clinically effective, then you should not be implying, imputing, inferring, or suggesting that it can do that. And I agree with that, really. So I think I'm absolutely fine with it, to be honest.
I think we are not that far away from even the approaches sometimes here, and the approaches of school medicine. Maybe they should work more together. Yeah. But it comes now a little bit. I think it's getting closer.
Yeah. Definitely.
So our hospital has now, for example, a little division for complementary medicine, because there is need for the patients.
Yeah. Definitely.
This is an unmet need so far. If we don't do it, they go to some quacks.
Yeah.
Who take them a lot of money out of their pocket.
Yeah.
For things which are really maybe sound strange to some extent. But so we can also have or the patients maybe have a better feeling if this is more integrated. So that comes more, which is, I think, good.
Yeah, it's excellent. It's lovely that you use acupuncture, on the wards for treating sickness in your cancer patients. That's excellent.
Is this used here, or?
No. It seems that you're definitely a year or two more advanced over in Germany. I think that, well, again, the laws are different, because, I agree in a sense you shouldn't imply or impute or suggest that something can treat cancer if it hasn't got the evidence. But also what's tricky is if you, say Simoncini, I don't know whether you're aware of Tullio Simoncini, the Italian oncologist. He was finding that alkalizing and using sodium bicarbonate on people was having good clinical effect. Now, he said, in my experience, this is curing cancer. But what he was saying is, in my experience, that this is my clinical experience. He's not saying that we have done all the trials and it's conclusive, but this is just my observation. And I was interested in having him speak and saying, well, this is his experience. But you're not allowed to do that. You're not allowed to say, oh, well, in my experience, this is what happened, because you're inferring that something is evidentially based when that's inconclusive. But then, if nobody is allowed to express their own personal clinical experience, then
not go that far,
then how is a substance gonna like Briar-Brown? How is it gonna get to a point where you're going to invest the money to do the full extensive trial if every time anybody has any experience and speaks about it, they're sort of squashed by the Cancer Act and told, well, you mustn't say that. So, I think people should be allowed to voice their own personal clinical experience and have it seen as personal clinical experience, and not, so that we can have, people with a different experience expressing that, and because that's the process by which maybe bicarb or maybe Briar-Brown or maybe vitamin D or C, starts to become known and shown to be worthwhile, investing that sort of time into, really. So it's a fine balance between those two processes,
so
I think.
Our dermatology clinic, they have done a lot of research on high-dose vitamin C and melanoma, and they are now in the process of publishing studies. and they have seen some interesting effects. Yes, so it's not, but this is really high dose. This is up to 150 gram infusion. So this is
That's a lot.
yeah, that's a lot. Yeah. Where you generate radicals. So normally the low dose is the anti-oxidative, but with the high dose you want to generate radicals to attack the tumors. So, of course, it's also what you want to do with it.
Excellent, Professor. Thank you very much indeed for your time. Thank you.